so much about all different types of cancer, but esophageal cancer is not one that we often hear too much about. What may surprise you to hear is that it's actually the fastest growing cancer in America. And joining us this morning for our Healthy Living House Calls is Dr. James Rosser, General Surgeon at Florida Hospital Celebration. Thanks so much for being here.
Hey, how y'all doing this morning? I'm fine, I'm fine.
All right, so let's talk about this because when you think about all of the underlying reasons behind why this kind of cancer is growing, it's not so surprising. We are definitely a kind of society that likes to medicate our acid problems, aren't we? We have a real issue with that.
Oh, let me tell you how big the issue is. About 26% of all primary care visits in the United States of America were for gastroesophageal reflux issues or indigestion. That's a 46% increase in the last 5 years. So it is something that lives with us every day.
All right, now you have a lot of patients I know who come to you who are constantly medicating their heartburn, and you name it, we've seen every commercial, we've seen every product on the store shelves. How do you know when it has become a problem serious enough that you have to go see someone?
Well, you know, a lot of people will have this issue. About 40% of Americans will have heartburn once a month. Another 20% will have it once a week, but there's 3 to 7% that live with it every single day. So if you're living with it every single day, that could be the first signs of a problem. And the thing that concerns me are the silent refluxes. That's what's contributing to the cancer because you don't know what's going on. So if I was at home and if you were my sister, I said, look, sis, this is what I would do. Think about the fiery five. If you have hoarseness sticking in the back of your throat, along with heartburn, belching, nausea, and then if you subsequently just have this post-nasal drip or your voice is changing, grade them 0 to 5, and if there's greater than 10 points, once you inventory, you need to go get a reflux checkup.
Oh, that's good advice. How do we know if it's something in our diet that is contributing? If there's something that we can personally do, something we should stop eating, stop drinking, are there things that you tell patients to stay away from?
Well, let's just think about this. Every medical problem, you should go from the simple to the most complex. So if you have a diagnosis, and that's the important thing, get a diagnosis that you can depend on. The first thing that we do, we look at diet, exercise. Now there's good foods and then there are bad foods. Okay. The good foods happen to be things like bananas, melons, chamomile tea, something called manuka honey that's done in Australia and New Zealand, grilled and baked foods. Those are all good foods. The bad foods,
it's all the stuff we like,
all
right?
the stuff we like. Alcohol, caffeine, chocolate, carbonated beverages, citrus beverages, and let me tell you, girl, canned foods. All canned foods have increased acid beyond that which resides in your stomach because they're trying to get an extended shelf life. And that's one of those gosh, I didn't know things that we have to look out for.
All right, this is all great advice, and I know you probably at home have a lot of questions because I know a lot of you out there suffer from acid reflux, from all of these heartburn, all of these kind of things. So Dr. Rosser is actually going to be in our web center answering your questions. He's going to be here for about another half hour, 45 minutes. So take advantage of his great advice while we've got him. Thank you so much for being here. We really appreciate you coming in this morning and answering the viewers' questions. And again, all you have to do is go to our website, myfoxorlando.com, click on top stories, and join the web chat. All right, all morning we have been talking to General Surgeon Dr. James Rosser he's down from Celebration Health about esophageal cancer. You've had a lot of questions for him. What are some of the best questions you've gotten this morning?
Well, the big questions happen to be, what is gastroesophageal reflux disease? What are the causes of esophageal cancer? But the overwhelming question is, what can I do to get rid of this problem? And we got a lot of little new special things we can do now that come on the scene.
Well, let's talk about one of them because you brought a demonstration, and this is actually fascinating, and this is something that you guys are doing. It's helping a lot of people.
Oh yeah, well, you know, magnets are just huge these days. I want to talk about the problem. Here's my favorite bracelet, and really the reason we have this problem is that when the food comes down, usually it goes through the esophagus right here. If you can zoom in, here's a kind of a door that's just like this bracelet. It stretches and then shrinks back, right? The problem is, how do you get that how do you recreate that, you know?
Right.
So this is the coolest thing that we do. Before we used to do, and we can do, take this part of the stomach, wrap it around, and kind of give it a little collar to reinforce it. But now, check this out. We can use magnets. And I love invention and innovation coming together, just like my bracelet. And you can put this around, and you can just wrap it.
Yeah.
And look,
that's amazing.
And then look
at this. On the
this is what it provides, this kind of a collar.
Okay.
If you let me, I'm going to dress the esophagus with a collar.
Okay.
And it's going to fit just like that.
Now, a procedure like this, is this something that you would do inpatient, outpatient?
No, well, you come in and you actually go home, and in a day. And this goes with our Nissen fundoplication. This is where we take this stomach and put a little collar of your natural anatomy, but this allows us not to disrupt the anatomy and allows us to recreate what your body already does.
That's amazing.
So it's really great. And I tell you, all of a sudden you get this that translates to this miracle. It's a modern day miracle.
I'll tell you what, medicine gets better all the time. All right, Dr. Rosser, thank you so much again.
Thanks
for answering our viewers' questions. We really appreciate it.
No problem. It was great being here.